begin with. So that was quite an amazing, that was my first major aha with animals. And then I started using, I use pie water in my practice all the time, and a lot of pet pads, and the nutraceuticals are phenomenal too. I had a case of a dog, well, it wasn't my case. This is interesting because it was actually a cross-line Nikken distributor had phoned, and their dog was deathly ill. And I said, she wanted to know what to do, and I said, well, it sounds like you should get that in and get it diagnosed right away with your regular veterinarian. So she did that. And it turned out it was an immune disease that was attacking the red blood cells. Now, and that's a very, very serious disease. And this little dog was very, very, very sick, very weak, lethargic, and it also had the mucous membranes were yellow. And anyway, came home with a standard treatment. They talked it over. She phoned me back. I said, well, you know, I don't want to get in the middle of this because it's not my case. But I said, all I can do is tell you my experiences, and then you, as a distributor or an owner of your pet, can make your own decision because you can get the products yourself. And so the prognosis was pretty bad, as is. And so she decided to use the Nikken products. And they already had the water system, and then they got the Canine Complete, and then also used the human artichoke sarsaparilla and then the immunity along with the water. And it was kind of funny, after a while, this dog actually would bark as soon as the optimizer would start. It's really neat. And to make a long story short, because I can go on and on, but this dog, within 2 to 3 days, the mucous membranes cleared up, and 2 to 3 weeks, this dog was just bouncing around like a puppy. It was just amazing, the energy it had. And that's just over a year now, and that dog's 100%.
That's great, Greg. Thank you. Thank you very much. We've had equal experiences as all the other veterinarians on this panel have had. We got introduced to Nikken by an accident. We were at a state fair representing our association, and a Nikken distributor noticed us across the way and introduced us to Nikken. My wife had chronic neck problems, and although she didn't respond immediately for several months, I responded immediately. I'm a quick charger. And that got her interest keyed. So we were using the products ourselves. We actually bought the pack, and we had the products because of the wholesale product. But I wasn't using it in my practice until I was embarrassed by a client who I had been treating his Great Dane dog for arthritis, and he was using NSAIDs and making the dog comfortable, and all of a sudden I noticed he wasn't using these products anymore. And he said, when I questioned him about this over some routine exam, he said, I don't need them anymore because a friend of mine gave me a magnetic collar to put on my dog, and it's given all the comfort it needs. So that opened my mind, and I do not like to be upstaged. I would like to be in charge and have the latest technology and so forth. And so you better open up your mind to this for veterinary medicine. And that led to other things. I have some cases I'd like to tell you about. I'd also like to tell you folks that we need your help. Veterinarians are very close-minded about using these products. They want double-blind studies. They want proof. And it's up to you to show them this, and you've got to get in and talk to the receptionist, to talk to their staff, and I'll tell you why. We have had, I'm from Ohio. We had the 4th largest veterinary meeting in the United States. We've had a Nikken booth at that meeting for 3 years. There are 200 exhibitors there, and it's a limited amount of time the veterinarians can spend at each one of these booths. And to try and convince somebody that this is something they should try, we don't have the time to do it. And they go at home and they forget about it, and unless a colleague tells them about it or a client tells them about it and they get upstaged like I got upstaged, they're not going to get any place. Well, we're going back again this year and try again, and David Dyser's going to join me, and we're going to show the video that you're going to see, and hopefully this will help to change it to your mind. I have some interesting cases that I would like to share with you. My first case was a little dog called Heathcliff. He was a Bichon Frise, about 12 years of age. We'd proven he had osteoarthritis of his back. We were using NSAIDs on him, and although the person didn't mind using these, I mentioned to her one day, I said, would you be interested in some alternative type medicine? And she said, well, what do you have in mind? I said, I'd like to have you take this pet pad home and try it. She took it home, and 3 days later I had occasion to talk to her again, and she said, you know, this was a multiple dog household, by the way. She said, Heathcliff is once more king of the hill. He is the top dog, and he feels wonderful. And so as a result, I sold her 3 more pet pads. I had a personal problem myself. I had a disc rupture into my back, which paralyzed the leg for a while. And so I had to have a relief veterinarian in. And she, by the way, had come by our booth at the Midwest Veterinary Conference, knew who I was, and before she wanted to find out what was going on as far as the veterinary clinic is concerned, she came in at my bedside and said, you're the veterinarian that handles the magnetic pads, aren't you? I said, yes. She says, I have an asthmatic cat that is 11 years old. My mother has a 12-year-old arthritic cat, and she said, I'd like to try a couple of those pet pads. So she bought a couple, and I saw her 6 months later, and I said, how are those cats getting along? She said, wonderful. My mother's cat can get around much more comfortably today. And she said, the only way I could control the asthma in this cat was with a steroid injection. And as you all know, we don't like to use any more cortisone in our body than necessary. She said, I had to use it once a month on my cat, or I found nothing else that would control the asthma. She said, putting this cat on the pet pad, I very seldom have to give it any long-acting steroid injection. And she says, when I do, I don't need to use near as much. The most outstanding case to us was a little white dog that got attacked by the neighbor's dog. This dog laid in a cage for 2 days. We had it on fluids, painkillers, all those sorts of things. I had pretty much given up. And then I thought, well, the pet pad's in the house. Our clinic and house are joined. I got the pet pad, put the dog on the pet pad. Within hours, I could see a difference in this dog. It was actually able to get up and wag his tail. I sent it home with the people, and believe it or not, neighbors' homeowners insurance bought the pet pad. Those are my stories. I have one comment I'd like to make, and this I would like to have as our purpose for this meeting. Open the minds of all veterinarians that complementary medicine is a valuable adjunct to our wellness and therapeutic program.
My name is Dr. David Dysert. I've been a veterinarian for 25 years. I saw Nikken 3 years ago when I was in massage therapy school. I'm also a licensed massage therapist, but it went right over my head. Didn't realize and see nothing of it. A gentleman comes into my hospital, bringing a pet in for vaccination. I said, what do you do for a living? He pulls out his back flex, shoe inserts. I said, teach me more. I want to learn more. He said, we have a wellness preview tomorrow. I'll go. Went to the wellness preview, called him up the next day, said, sign me up. I'm ready to go. I see the potential in the veterinary field that's wide open. Now, I've learned something just sitting here today in the thermographics, the use of this in veterinary medicine. And I see the potential for where this is wide open in the veterinary field. I've got to tell you a real quick story. A client comes in to me with a dog, and he says, I think my dog is dead, but I want you to tell me for sure that my dog is dead. Okay? So do anything you have to. I go get my dog, Chewy, who's a Labrador. Bring Chewy in. She comes in, she sniffs the dog. She walks outside. Then I go get Stinky, that's my hospital cat. Bring Stinky in. Stinky comes in, she sniffs the dog. Walks back out. I come back in, I tell him, your dog is dead. He said, okay, fine. Here's your charges. $600? How did you get $600? Well, it's simple. $300 for the lab test and $300 for the CAT scan.